But there is a very key component. I don't know if it is probably being observed in Homa Bay alone, but we indicated that each region has its own specific challenges. As we discuss this, I've never heard, even during the speeches, anybody mentioning the young boys. The young boys. Because you cannot sit and pretend that the contributors to the teenage pregnancy is not the young boy. Probably around 90%. You engage these young girls, you have fruitful deliberations with them, but at the end of the session, when they walk away, they join the very, very boy. And I don't know how possible is it for an empowered girl to stay or marry an empowered boy. Is it possible? It's not, probably 1%. But an empowered boy is able to cooperate and stay with an empowered girl. And therefore, we have to think about this as we start to implement this initiative. That's when we will address some of these challenges we are facing. And it is in the public domain. We have maternal mortalities, the perinatals. A good population are young girls. Yes, I know as a country, already there have been a talk. They have developed even a curriculum about preconception care. But even from this setting, I know there are those who have given birth or participated. How many? I don't want you to raise your hand and respond. Among your kids, did you plan, I want this pregnancy this month? Even we seated here, a number, they just realize themselves pregnant. And therefore you can see and look, find where the young and empowered who still need a lot of information about herself, her body development is. And therefore, this calls for stakeholder, different departments, individuals coming together and having a talk. And must be a very much open talk and candid, so that we come up with a very clear interventions, and also involving the young girl, and how do we loop in the young boy for us to address this. For the maternal death, we are also victims, but to some extent, the data we are currently as a country registering might be speaking to us, the state where the country is. I'm sure in the past, the community deaths and some even facility deaths were not being recorded and reported. And therefore, as we make the milestone to be able to openly and report these cases, and therefore we need to have reviews that is focused and able to address the R. And this R cannot be addressed if we cannot address the health systems. And the health systems is big, but the most, to me, that is our priority, is the financing. Without financing, there's no HR. The commodities, yes, we are talking of ring-fencing. Do you ring-fence what you have not allocated? And even the previous allocation, what did you appropriate towards commodity? And therefore, it is something that as a country and as a county, we must have a focus and prioritize for us to move. We were just blindfolded But it is good in the whole country we are now aware, and every responsible officers are aware that the donor world is dwindling. And it had been clear that by 2030, the country should be able to finance family planning on their own. If you ask the national government, what budget did they allocate last financial year that is now ending, and what percentage of that was appropriated? Same to the county. Same to the county. And if we are not able to say probably what were the challenges why we were not able to appropriate and think and start talking about ring-fencing, then we are missing the direction. We need to get those issues that made us not to appropriate even a single percentage, and probably now accounting on what the donor gave us to have made us to make the strides that the country has done. And therefore, as we walk, we are still requesting for the leadership. We know I think this week, there was launch of the MPDSR Committee National that will be updating the presidency, and also there's a dashboard by the county governance leadership, and therefore let that dashboard not be just a dashboard to show us figures. Let it be a dashboard to help us use those data to make decisions that are able to address that. And therefore, up to that point, I would say that this project is coming at the right time. It is a time when both the national and the county government are in confusion to say, because this is when now they are realizing they need to have a budget, involve the relevant departments or officers who are allocating. And that is the county assembly and the parliament. Without those two, even the executive would not have anything to talk about in terms of budget. And RHN, together NCPD and the High Health Project at the Ministry headquarters, we welcome you to Homa Bay, and we will work together to ensure that we achieve together, not achieve as one-sided team, but as a community. And therefore, as we move, we will give this feedback to the leadership of Homa Bay, and we will ensure that this project becomes a future that would be talked about by the generations to come. Otherwise, thank you.
Asante sana. That's Odawa Jacob from Homa Bay County. I would like to call on stage Mr. Joseph Mwangi, County Commissioner, Tana River. Karibu sana. And after he's done with his remarks, we'll move straight to David Saruni, County Commissioner, West Pokot. Karibu.
Good morning, everyone. Riding on the protocol already established, as you have heard, I'm Joseph Mwangi, County Commissioner, Tana River. I wish to thank the might behind this initiative. Actually, it will be of great help to us. The doctor who was here from Tana River actually explained the terrains of Tana River. Only that I will add that we have two types of economic activity, and that is agriculture and pastoralist. So most challenge is on the side of pastoralist, because like today, you can leave 1,000 people here. You come there after 1 month, you find empty structures, people have been moved. However, we have a problem in Tana River. When I was checking on the data there, the number of girls who are aware that condoms can prevent diseases, HIV. You know, hii Gen Z tuko nao, kitu anaogopa sana ni mimba. So they don't even understand that condom can prevent HIV. So we need to sensitize them. And I want to give a story where Masherima here, she has been leading the news while I'm talking in in Tana River when there was a conflict between the communities. You know, since June last year, there has been like 14 deaths, and they resulted from a rape of a girl. We have inter-community conflict. One tribe, 2 men raped a girl from the other tribe. And then wazee walikaa committee, they agreed that the payment is 60,000. That, because she was raped by 2 men, each man will pay 30,000. And when they sit down, that money is not even going to the girl, not even to the mother. It is wazee to eat. Then there arose a conflict in between because the money was not given in full. That is 60,000. And that triggered a conflict that resulted to 14 deaths. If we were able to talk to these girls, because when I was when I called them for an interview in my office, the girl said she didn't know that when she's raped, she's supposed to go to the hospital the way she is. So she just washed, you know, she took shower, washed the clothes, and then there she is complaining. So we could not get evidence. So when you come on the ground through this health initiative, we'll be able to talk to them and tell them this is what you are supposed to do after something has happened. On the health centers, the doctor said here, you know, I'm the chair of a fund called Equalization Fund. Last time we allocated funds because the fund go for the roads, electricity, health, and water. So this time around, when we get this allocation, which you are about to get now, we will put more emphasis on constructing and equipping health centers so that we are able to provide health to the people as much as possible. When we are doing, sorry, I will just finish. When we are doing mobilization, 100% transition, after His Excellency President pronounced himself that we need to mobilize children to go to school. In Tana River, it was 21%. Mostly, girls had not even joined the school. You find a whole sub-county, we had only two students only transiting from grade 9 to 10. And it is because of the challenges. I talked to my women rep last week. I told her, I have inquired from the teachers, and they're telling me these girls, they are shying off because they don't have sanitary towels. And I told Mama County, you have to come, me and you, we go and distribute this. She's talking of distance. I told her, no, that one I cannot agree because there are buses for schools. We can ask the teachers to send the buses to collect the sanitary towels. No, she told me, even we don't have enough. I told her, no, I can talk to the PS. And I talked to the PS, Jeddah, Madam Anne Wangombe. She is a good friend of mine. And she has promised to provide more sanitary towels. So when this team come to the ground, they are wrought internally we are going to do for our girls. Thank you and God bless you.
Thank you so much. Let's have on stage David Saruni, County Commissioner, West Pokot. And immediately after him, we will get into our panel discussion. Karibu sana, David.
Good morning, everyone. Also allow me to write on the protocol already established. As you've been told, my name is David Saruni, County Commissioner, West Pokot. And mine is only a comment, very briefly. West Pokot is a county relatively small compared to the other counties, about 9170 square kilometers, with a very harsh terrain of mountains, the poor road accessibility, especially on the mountains. And you also have people living on top of those mountains in the lower belt of Turkwell, and also has some challenges because we are also bordering Turkana, Trans Nzoia, Marakwet, and Uganda on the western side. Probably this project has really come at the right time. Maybe this project, an initiative will be able to address the challenges that sexual reproductive services that we are facing in West Pokot, especially because most of the problems that we are facing there are cultural in the dimension of early child marriages, which are very prevalent, and also the FGM, because those are also cultural. And I'm sure what has been, the project is also coming to address such issues. And more importantly, The project is also coming to is using a multi-sectoral approach to be able to address these issues. And as it has been said, the problems are systemic, and therefore ours, I think, as heads of the counties, what we are going to do is to ensure that we coordinate the programs and the programs that these programs, we ensure that everybody is brought on board so that we can be able to address these issues. Otherwise, thank you very much.
Asante sana, David Seruni. He is the County Commissioner from West Pokot. Ladies and gentlemen, improving outcomes for adolescent girls and young women requires collaboration, strong leadership, and sustained commitment. And to better understand this, we now transition into our panel discussion where we will explore these themes deeply. And I would like to call onto the stage our panelists, starting with Ms. Mary Wandia, who's the Regional Director, Africa, Co-Impact. We'll also have on our panel Dr. Johnston Kuya. He's the Senior Policy Officer, Strategic Partnership and Gender, Embassy of the Kingdom of Netherlands. Karibu sana. We also have Charity Koronya, representing UNFPA. Karibu sana. And Honorable Justice Jane Onyango. Honorable Lady Justice Jane Onyango. She's the Environment and Land Court Judge. She's also a member of the International Association of Women Judges, Kenya chapter. She's representing the president of the association. Karibu sana. Last but not the least, we have Julius Mbeya. He's the co-CEO of Loala Community Alliance. Karibu sana. Karibu. Everybody has a mic? There's one more here. Oh, you have one. Okay. Karibu, karibu, karibu. Okay, so we want to understand these themes more deeply, and I will start with a question that I hope all of us can respond to before we get into the specifics. Why is this moment critical for investing in systems that support adolescent girls and young women in Kenya? Let's start with you, Julius.
Yeah, good morning, and it's an important question. I think the statistics that have been shared are telling enough, and much as there is a focus on these 5 counties, I think there is an acknowledgement that this is a countrywide problem, that changes in these particular counties have the potential to change something across Kenya. And it's also a testament to the fact that the problem is not equally shared across the country. The fact that there is a disproportionate impact that is faced by young girls and women, adolescent and young women across the country is not the same. And the realities in these counties, the reality in these counties are different, and so targeting counties with the most and the biggest problem has the potential to change the course of the country as a whole. So not just by addressing things at that level, but really looking at systemic issues that have the potential to change things across the country.
Thank you so much. Thank you for the question. I think this moment is critical, especially given what we know that has been happening to funding for health. And I think that it has taught us that we have to sort ourselves out. And so it means that at this moment, we really need to ensure that we have sustainable financing that is mobilized domestically, and that we also own the interventions that need to impact our people. Of course, philanthropy and other people can catalyze innovation and development partners can support, but long-term impact depends on that domestic ownership. And so I think that's why, for me, this moment is very critical. Thank you.
Yeah, just to add to what my colleagues have said, first, I wish to really thank RHNK for focusing on this vulnerable group. So to me, this is really a timely intervention because the target group in itself is very vulnerable. They have been left behind, and there are so many challenges which really deny them access to services. Among them is the systems, of which the systems include the legal legislation and also the commodity itself. So to me, it's really timely, and because the group is very, very important, they are the future of the country, their needs are always sidelined.
Thank you very much. I think for me, looking at the presentations that have been done in the morning, just picture a young girl in Samburu, 16-year-old girl. And of course, we are used to our programs and projects, then development comes, and then of course services improve. We have outreaches, commodities are stocked, there is some bit of funding, and then the project ends. And then slowly, all that we've done starts to slow down again. So from her perspective then, that support is just temporary. And I think that's the reason why we are here today, because our health project, I think our initiative, Nelly already told us, I think has something differently. And I'm very much impressed with the level of government participation from different quarters. I think that's quite crucial for this kind of work. So for me, I would say, in addition to what my colleagues have said, with this donor funding that is tightening up, services have to continue, and the systems needs to continue as well. So we just have to build a strong system, because they don't happen by accident. We have to do it deliberately, and I think that is the reason why we are here today. Thank you.
Thank you. Honorable Lady Justice, why is this moment critical for you?
For me, we don't use mics in court. Okay. First of all, I'm sorry that I am coming in this late. I had a list of cases to deal with, and I had to rush through it before coming. So I missed out on the presentation, so I'm a bit disadvantaged. But this is a topic that is very close to my heart. Those of you who know me in the room know that for the longest time, I worked at FIDA for 11 years in my past life before I became a judge. So it's an area that is really, really close to my heart. And why it's important for us to focus on adolescents is because in most situations, they are vulnerable, they are not able to speak for themselves. And you know that if we don't focus on this demographic, then we can end up losing a whole generation. So it's really critical that we ensure that they have access to this area of rights that is very specific, and that really where girls usually are the ones that suffer the worst form of effects when their rights to sexual and reproductive rights are violated. So I also looked at the areas that the project intends to focus on. I think it's spot on. You know very well that girls in those particular counties, which are generally represented in most projects in the country, they are poor, they are not well educated. They don't have the services that they ought to have, that we would readily have perhaps in other counties like Nairobi, Kisumu, and the big cities. So for me, I think it's really, really a timely project, that one that ought to be supported. I'm aware of what's happening in the area of funding, even though I'm not in the NGO world anymore, but I've kept touch with organizations that are focusing particularly on the area that we are discussing, and the shrinking of funding that's happening, and what that really means for the girls and for the women of Kenya. So even though right now I'm busy dealing with Mogunda matters, my heart is still in this area. So I think I can be able to contribute to this discussion. Thank you.
Thank you so much. And because you've mentioned, you've spoken about global funding cuts, I'd like to bring in the representative from UNFPA. In that context, how is UNFPA supporting governments to strengthen systems and ensure sustainability of sexual, reproductive, and maternal health interventions?
Okay, thank you very much. UNFPA works very closely with the Ministry of Health, NCPD, and partners including RHNK, Maria Stops Kenya, to really strengthen the systems. And one of the biggest things UNFPA has done, it is to support the government of Kenya to have a national integrated logistic management information system. This is the system which ensures that commodity are at the right place, the right quantity, and at the right time. Kenya has actually been able to win 3 global awards with a system that was developed by KEMSA staff and the Ministry of Health. This system ensures that at your desk, you can be able to look at your order which you have made, and you are able to see where your order is. It enables you to check also whether you are having commodities which are about to expire. So in short, we all know, the programmers in the room, know that without commodities, there is no program. So the LMIS is very critical, and I've mentioned the partners because RHNK, Maria Stops are all members of what the Ministry of Health has established called the National Order Management Team. This is the team which oversees the commodity distribution and ensures that really people get the right quantities. In addition, there are systems also in the county and at the sub-county level. There is the county order management team and sub-county order management team. Apart from the LMIS system, and just to say that this system was supported by UNFPA in collaboration with other partners, and it was purely for family planning. But I'm proud to say that with the Ministry of Health leadership, this system has been adopted by all the programs in Kenya. All the programs are now using the LMIS to ensure that commodity management is really working in Kenya. So I think it's good we really give a clap to the Ministry of Health and KEMSA. Getting 3 Glow Award as Kenya, I think it's a big plus. It's not that we don't know how to brag. I think it's the high time we start bragging for our achievements. Second is on the issue of commodity funding. UNFPA realized long time ago that the issue of domestic financing is a challenge, and I'm happy again to see the DG of NCPD here and Dr. Bashir. And with NCPD and the Ministry of Health, Kenya signed a compact of commitment with them. UNFPA, signed a compact of commitment with the government of Kenya. And this compact of commitment ensures that UNFPA is able to contribute certain amount of value for the family planning commodities, and the government is able to also contribute. In this case, the compact was signed in 2022, and again, I'm happy to say that the government of Kenya has been able to honor the commitment. They have paid, they have refunded UNFPA the value of the agreed commodity in 2020, 2022, 2023, and 2024. We are 100% sure that with Dr. Bashir in the room and Dr. Sheikh, that the government will be able to honor the other commitment. So with this compact, apart from UNFPA procuring and having the government contributing, it comes with a match fund, whereby for every dollar which the government puts in, UNFPA is able to give $1 on top of the normal routine commodities procured. For example, if the government is going to now procure commodities worth $200 million, UNFPA will be able to also procure the same dollar to dollar. However, there is a caveat that the procurement should be more all at the same level as the previous year. And that procurement should only come from the government of Kenya funding, not from partners. Just to add to that, the other thing again is that with NCPD, there has been a very high level advocacy also to ensure that the private insurance integrate family planning in their schemes. And NCPD has been leading this advocacy, and we have seen 3 insurance firms have been able to include family planning in their schemes. So an appeal to all of us as SRH champions, please ensure that your HR, when they are engaging the insurance at the beginning of the year, family planning is a package, not by the way, and it is really comprehensive and well spelled out.
Thank you so much. I would like to bring in Co-Impact, because you've been a leader in supporting locally led organizations to work closely with governments and other stakeholders to strengthen systems. What has informed this strategic shift, whereby do you see value in investing in systems rather than standalone projects?
Yeah, thank you for the question. So as our name, as we are named, Co-Impact, means we collaborate for impact as a philanthropic collaborative. And we actually did not begin as a strategic shift. We began with listening. So our founder and CEO met hundreds of social change leaders across Africa, Asia, and Latin America before setting up Co-Impact. And she asked them one question: what do you need from philanthropy to create lasting change for millions of people in your context? And the answers were remarkably clear. The leaders, they wanted to address root causes, not symptoms. They wanted to strengthen public systems, not building parallel ones, and strengthen these public systems with their communities. And they needed long-term flexible funding to do that, and the trust to be able to work with their governments. And that shaped our model. And so our focus is very simple. We identify organizations in the Global South that are willing to really transform public systems to impact millions of people. And we simply focus on strengthening health, education, and economic systems so that they can serve people more equitably and more effectively. But why systems and not standalone projects? It's because systems endure, they remain. Projects can deliver services for a few years, but strong systems continue delivering long after funding cycles close. And we all know governments do not operate on 2 or 3 year timelines, and so also sustainable progress should not be timed. So by investing in systems, we have seen local change makers leverage public resources, strengthen institutions, and scale impact far beyond what philanthropy alone could ever achieve. And our partnership with RHNK is a perfect example. They are not doing parallel service delivery. They are aligning with government priorities and designed for sustainability. And I think for transforming systems, working together is not a slogan, it's a requirement. We have to work together.
And for Luala, as a local organization working directly with government to strengthen health systems, I know today you have a talk at Bugumbe Health Center on maternity services, contraception for men and women. What has been your experience on the ground? What approaches have worked well?
Yeah, thanks very much. I think the first place is to ask ourselves, how do young people access services? In my experience, I think we have an assumption that a young person will go to the health facility, talk to a nurse or a clinical officer who is either their uncle or somebody the age of their parents, and they would be able to discuss their personal matters and receive a service and go home. It just doesn't happen. And if there is experience that that happens, it is at the level of the percentages that we have seen. So I think we need to rethink how young people access services. And what we have experienced on our part is that young people receive services when they are reached by fellow young people. There are models that have been tested out here, youth peer provider models, where young people provide education to fellow young people, and then they refer them and direct them to places where they are receiving services. We know initiatives around youth peer provider corners or youth-friendly corners. We know initiatives that the ministry has driven around like whole site orientation, which is to work on the perceptions and attitudes of healthcare workers to be more receptive to the needs of young people. I think those are the things that we need to double down on so that we can actually ensure that young people are receiving these services, are in comfortable spaces, and healthcare workers are able to meet them and meet their needs. I think our experience in working with government is, number one, I liked what Nelly corrected here. When I saw this as a project, I said, project, great. How many projects has this government seen? Projects come and go. So if we are going to approach this as a project, then we'll give it a timeline, and then we'll do the activities and report on the activities, but we will still end up with the same results. So I think long-term view, knowing that in partnership with NCPD, this is not just about now. It's about leveraging resources beyond this partnership with CoImpact, leveraging partnerships with other actors in this space so that we can look at long-term change in what is happening. Some of the counties that you have mentioned are counties where we are, and we are looking forward to collaborating with you all to ensure that we are doing this in a more collaborative way. The final point I wanted to make is you are on a good space, starting by co-designing and co-planning with government. And I like that NCPD is actually at the forefront of this, because that is when it really means that it's government-led. And so even at the county level, how do we ensure that our reproductive health coordinators, the directors of health, and the structures that we have at the county level are leading so that our role is more facilitative than leading? Thank you very much.
Thank you so much, Julius. I would like to bring in Dr. Kuya now. The Netherlands Embassy has taken bolder approaches towards long-term investments, particularly in system strengthening. Do you believe this level of transformation is achievable within the current developmental context?
Thank you very much. Yes, I do believe if we have to redefine our partnerships and our different models, I think that way, then we'll be able to achieve. If all of us as donors, as government, as civil society, and private sector come together, move from this kind of a transactional relationship that we always have, what my brother is talking about, to co-investment in terms of shared outcomes, then I think it's possible we can be able to achieve this kind of results in a more institutional, but also, I would say, resilience manner. And I started by talking about the story of this girl in Samburu. But again, now if you flip it a bit, we have a county, I don't know, maybe from the 5 counties that were presented, there is one that they have a very strong, I think let me pick Homa Bay. It was very good to hear from the reproductive health coordinator. They have a very strong adolescent health annual plan. There is a protected budget line. There is a dashboard that tracks access to stockouts. Then we have a local private health technology firm that provides linkages between these dashboards to that national platform that was launched the other day. And then we have also a telehealth platform that connects rural providers to specialists at whatever place for advanced kind of consultation. And then there is a supply chain partner who ensures last mile delivery. And then finally, we have a civil society that continues to engage the county assembly on accountability, monitors implementation, the county reviews budget, and the story goes on. Then you're sure with this kind of investment, then services will continue even without funding. And that's exactly what we are trying to see if we can be able to reshape this architecture, but also ensure that services continue and are transformative at the end of the day. Yeah, thank you.
Honorable Lady Justice, what role does the judiciary play in protecting the SRMH SMRH rights for adolescent girls and young women in Kenya?
Okay, the role of the judiciary is to interpret the constitutional provisions on sexual and reproductive health rights. Article 26 to be precise. You know that it's usually very political, So, yeah, our role is to interpret that section in a manner that ensures that the right is protected, as was the intention of Parliament. For that article to have been enacted in our Constitution, you're aware that there was a lot of discussion that went on. There was a lot of opposition to the right to sexual and reproductive health rights. Because everybody was just seeing a big banner written abortion, isn't it? They were not looking at all these other aspects of access to, information, access to commodities, and access to, access to abortion. Let's just call it by its name. So, when such cases come to court, then it is the duty of the court to look at that section, look at the case law from other jurisdictions, particularly the Commonwealth jurisdiction, because that's the one that we are able to draw our area of practice from, and to see what has happened in other jurisdictions with respect to this right. Is Kenya able to take bold steps to advance these rights? You know there have been a number of cases that have touched on this right. Just meant to mention just a few. The case that FIDA filed, Federation of Women Lawyers versus Attorney General. I don't know how many of you are familiar with that case, but the lawyers in the room can give you the brief facts and what the courts decided. We've also, the courts have also been able to look at the area of violence in the area of how do you call it? Obstetric violence. I know that back in the day when I was at FIDA, I really missed those days. I can see Lucy smiling. We did this report called Failure to Deliver. I don't know if you've all read that report. The experience of women interacting with the health system when they go to deliver, and the failure of that system, of the health system, to women, ranging from actual physical abuse, but also emotional, just the lack of support that the women are exposed to in the maternity wards. It was horrifying, to say the least. I don't know if copies of that report are still available at FIDA. I think I don't know if it was, Lucy, maybe you might be able to tell us. You've remained in touch more than I have, but it's a very telling report. A lot of research went into it. Visits were made to Pumwani and other hospitals, just to document what women go through when they go to that maternity ward, and it was extremely horrifying. And I remember we presented that report to the Minister for Health at that time, and she promised that something would be done. I hope it has been done. I have not gone to the maternity ward since then. I went many years ago, but those who've interacted with the system would be able to tell us. Yes, so that's one area that the court is concerned with. We also, look at holding government accountable, because the government signs many laws, international laws touching on this area. So the role of the court, if one was to file a case, would be to see whether the government is actually honoring its obligation under the international statutes and obligations like CEDAW and others. And even under the ones, at the regional level, not just the international ones, but also the ones at the regional level. To what extent is the government able to be held accountable to ensuring that these rights are respected? And then, of course, the courts will sometimes issue what we call interdicts, where we feel this is an area that's provided for in the law. It looks aspirational, particularly when it comes to social and economic rights. The government will always say they don't have money to put into this, to realize this right. So the courts would come in to say, we are giving you a time frame. Come and report to us after maybe 6 months. At least show us that you're taking steps to ensure that this right is actualized. Because it's all very well to have a good document, to have a good constitution, but where the rubber meets the road is how well is this constitution being implemented. And it shouldn't just be implemented when it comes to political aspects. Here we are talking, where the young girls, the women, women's rights are being violated. How is the government responding in terms of ensuring that those rights and do not just remain aspirational, do not remain decorations in our constitution, but they actually are able to say, yes, I went to this hospital and I can attest to the fact that there's this improvement, there's more access, there's, things like that. So that's the role of the court.
Yeah.
And of course, where the rights have been violated, people have been able to come and the courts have spoken to those issues. Yeah. In various cases.
And I would like your closing comment so that we can do that with everyone else. What is that one action that you'd like to see government take to ensure sustainability and lasting impact, Honorable Age Justice? And your government. So.
Okay, I'm government. Okay, mimi ni government. Now I'm on the spot. As I was coming here, I didn't think you were going to put me on the spot as being government. But what I can say, the one thing that I would want government to do is to put in place policies that ensure that women and girls are able to access their sexual and reproductive rights, and not to claw back on what we already have in the Constitution. That we really must remain vigilant. There's always that possibility that this right is open to discussion. It shouldn't be. To have arrived at having it in the Constitution. I know the discussions that went on I don't think that at this time in our history, we should be talking of clawing back on some of these provisions in the Constitution. They have to be protected, and I think it is the role of the court to protect that right.
Thank you. Dr. Kuya.
Thank you very much, because it's always a very interesting question. But I think from my end, there's another layer that we haven't spoken much, and which is also the pushback against SRHR work. We have a lot of political resistance, cultural resistance, and all those things happening within our community. So we must really pick a very multi-sectoral approach when it comes to driving this kind of change, because at the end of the day, SRHR also has to be defended, both from a normative perspective, but also from an institutional perspective, and they go both in hand. So if, and I'm very impressed actually with all the government stakeholders here, from the counties, the national, I think the DG spoke well and reminded us that we cannot ignore SRHR, because for us to achieve this long-lasting change that is very transformational, we have to combine all those components. And the religious leaders are also quite important in this conversation, because they are in the communities and they need to support also this ongoing work. So for me, I think I will try and summarize there. Thank you.
Ms. Koronya, what is that one action?
The one action which I'm asking Dr. Bashir, is the government representing the Minister of Health, is that Kenya, before devolution, was 100% funding for family planning commodities. So my request to the government of Kenya is to ensure that now that most donors have pulled out, it is to ensure that the government goes to that level of funding commodities 100%, and also prioritizing family planning as a strategic program in Kenya, just like other programs, so that we do not lose the gains which we have made. So many countries look upon Kenya to really learn. They come to learn. They get so excited. We do not want to lose the gains we have made. So 100% funding of the commodities by the government.
Thank you so much. Ms. Wandia.
Thank you. I'll cheat a bit and say that I would urge the government to listen, to partner, and to fund. Listening especially to adolescent girls and women, and listening to their lived realities, and ensuring that their voices really shape the programs is very, very critical. And then partner, because sustaining impact requires coordination between national, county, civil society, development partners, and communities. And fund, ensure that planning and policy commitments must be matched with predictable, sustained domestic investment, because we know transforming the health system will not be a sprint. It is like a relay race, and so sustained financing will ensure that the baton is not dropped. Thanks.
Thank you. Julius.
Yeah, I think this initiative is key to us realizing our demographic dividend, which has been talked about very much. I would say, how do we incorporate and make part of the system models that reach young people beyond the health facility? How do we reach young people beyond the health facility and make that part of our health system delivery? And then to our county counterparts, because this is going to go to the ground, let's go to the ground. Kwa sababu, kwa grao vitu ni
different.
Yeah, thanks.
Asante sana. That's Julius Mbeya, the co-CEO of Luala Community Alliance, Ms. Mary Wandia, Regional Director, Africa Co-Impact, Dr. Johnson Kuya, Senior Policy Officer, Strategic Partnership and Gender, Embassy of the Kingdom of Netherlands, Ms. Coronya from UNFPA, representing Dr. Pilar Molina, the Deputy Country Representative, and Honorable Lady Justice Jane Onyango. Asanteni sana, tuwapigie makofi as they take their seats. You can take your seats. Asanteni sana. And I think our panelists have done a good job to ensure that we're getting insightful thoughts about why this initiative is so important, why it needs to be sustainable, why we need to collaborate to align and to strengthen systems. And at this juncture, and I think we've heard so much from everybody else, except the adolescent and young women, for whom this project is for, right? So allow me to welcome to the stage Leila Abdul Khair, who's the CEO, Youth Voices and Action Initiative. Leila, karibu sana. Tumpigie makofi. She's representing those who have brought us here. Karibu.
Is it good afternoon or good morning? Good afternoon, everyone. All the protocols observed. My name is Leila. I lead at Youth Voices and Action Initiative. It's a grassroots organization based in Coast Kenya. And I'm also a young person and a young advocate from Reproductive Health Network. And I'm here to just to carry the voices of young women at the Coast region. And I want to just share about today's on how we are able to launch our health initiative. And we are here to ensure that adolescent girls and women voices are not just heard, and they are just felt. So I want to also acknowledge the Ministry of Health and also the commitment both from nationally and also at the county level, and to, when it comes to adolescent health, that has laid a foundation upon of what we have built. And this initiative is not just a replacement of your work, but it is an implication of what we are being able to do it. And I want to go to the reality when it comes to costs in relation to Tana River. And with my fellow speakers who are here, and I don't know how many of you that you have been able to be in Tana River County. You have been there. And I've seen my friends here, Hawa and the director, and I just want to take you through of what Tana River is. And Tana River is actually a county in Coast Region, and it is actually in the land of Tana. And it's actually a county that has, it's arid and pastoralist county. That is mainly the agro-pastoralist county that mainly consists of communities from Pokomo, Orma, Wardei, and different community that they live there, that they usually have a lot of struggles. And in Tana River, it's actually a home of more than 380 people who are mostly young people. And in terms of how the young people who are being able to dream about their future. But I want to go back to the reality of a 16-year-old girl coming from Tana River, especially in Madogo. And because a young girl coming from Tana River, especially in Madogo, the future of this girl is actually often to a lot of barriers. Because this girl who walks in a long distance health facility, if she gets there, she actually prays that the healthcare worker is actually kind to her, that the medicine or commodities are in stock, and that she can be able to afford services. And this young girl, she has actually heard about HIV, and 35% of her peers actually have a lot of stories about HIV. And when she heard about contraception, only 1.3% of these girls at her age actually use it. And when it actually, when it comes to this girl, she usually gathers a lot of courage. And sometimes when she wants to ask for help, her response, especially when it comes to the community, there's a lot of judgments. So we had a lot of discussions with these girls. And one of the girls actually told our team that we are actually scared about condoms and pills at the hospital because they will ask us about who are we sleeping with. So this young girl actually prefers to stay silent in that situation. So you can imagine staying silent leads to teenage pregnancy. Staying silent actually leads to unsafe choices. And staying silent leads to school dropouts. And staying silent leads to early marriages. And even FGM actually leads to her body autonomy that before she understands it. And sometimes we are looking at this girl this girl, it's not about her failing, it's about the system failing her. So when you think about this girl, we are looking about the walls and barriers that actually holding her back. So when it comes to lack of information, we actually ask ourselves, how can she make choices? Only 35% of her generation understand comprehensively HIV, while comprehensive reproductive health education is whispered and not taught. So when it comes to limited access to affordability, even if the services exist, even if the hospital exists, there's a lot of hidden cost complication because this girl has no income, has no job. There's a lot of cost complication when it comes to transport for her to be able to access that facility, to access services. And most of these services are actually very unaffordable for her. So when it comes to systemic barriers and norms, we've seen a lot of weak implementation of policies, especially at the county and national levels, is a barrier when it comes to access to these services. So when it comes to also declining in terms of the donor funding and the slow domestic replacement of the outreach programs, it is actually cut fast. And the deep-seated in terms of the cultural norms when it comes to the young girl in Tana River, most of this girl, her health is not a priority, but it's a priority for her husband, it's a priority for her father, it's a priority for her brother, but it's not her priority to be able to make informed decisions about herself. So we are here because the change is actually possible, and through her health initiative, it's actually designed to be able to dismantle these walls, and with the great partnership with the Reproductive Health Network, with the ministry, in terms of how they can be able to dismantle these walls. So we recommend actually the Ministry of Health and the County Department of Health to prioritize adolescent health and policies when it comes to service delivery. And we must strengthen these efforts together. So to our actually development partners and governments and every stakeholders here, let's continue to invest in our health. When you talk about investment, we are talking about the systems, we are talking about to make health to be sustainable. We invest in policies and financing and supply chain, and the young champions that are actually on the ground and the young people who are actually on the ground. And on behalf of adolescent girls and young women in Kenya, specifically coming from Tana River, Garissa, Homa Bay, Samburu, and West Pokot, and I want us to be able to say that we'll be able to provide the learning and document our realities, and also document our successes and failures. And we will be able to show what actually works and what it doesn't, and to be able to build our voices as evidence. And we will be able to use our stories to shape the national policies. So it's actually a lesson to see how we can be able to transform our nation, and also being able to transform adolescent girls and young women. And let's continue to invest in adolescent girls and young women. especially when it comes to sexual reproductive health. And thank you so much.
Thank you. Thank you, Leila Abdul Khair, for those powerful reflections. Ladies and gentlemen, we now arrive at the highlight of today's program, which is the official launch of the Her Health initiative. And I would like to call the following people to the stage right there at the corner so that they can lead us in this launch. Dr. Bashir Hassan, Director, Family Health. Dr. Isaac Hassan, Director, Family Health. Dr. Mohammed Sheikh, Director General, NCPD. Ms. Miri Wandia from Co-Impact. Nelly Munyasia, RHNK. Elsie from CRR. Mala Tabot from IPPF. Charity Coronia, UNFPA. Dr. Johnston Kuya, Netherlands Embassy. And executive directors from partner CSOs. Karibuni sana. They will lead us in the launch as the choir is also preparing for the project theme song. Dr. Isaac and Dr. Mohammed Sheikh, take it away. The floor is yours. Hi, let's count down. 5, 4, 3, 2, 1. And there you have it, the Her Health project officially launched.
Zimeimarisha kote huduma bora zenye heshima, wasichana wetu, vijana wetu na mama wote, huduma bora zenye heshima, wasichana wetu, vijana wetu na mama wote, huduma bora zenye heshima. Sekta yetu ya afya kote zinaendelea kuwa bora kwa jamii. Kufadhili mradi huu, huduma bora zipatikane. Sekta yetu ya afya kote zinaendelea kufadhili mradi huu, huduma bora zipatikane, wasichana wetu, vijana wetu, kina mama wote, huduma bora zenye heshima, wasichana wetu, vijana wetu, kina mama wote, huduma bora zenye heshima. Kusaidia serikali, HAHEF imehakikisha wafanyakazi na wafadhili kote, ndani na kimataifa kote Kenya, kusafisha ya wamama kote Kenya, ukame, huduma bora zipatikane, kusaidia serikali, HAHEF imehakikisha wafanyakazi na wafadhili kote, ndani na kimataifa kote Kenya, kusafisha ya wamama kote Kenya, ukame, huduma bora zipatikane, wasichana wetu, vijana wetu, kina mama wote, huduma bora zenye heshima, wasichana wetu, vijana wetu, kina mama wote, huduma bora zenye heshima, huduma bora zenye heshima, huduma bora zenye heshima, huduma bora zenye heshima, huduma bora zenye heshima.
Makofi, Makofi. Thank you so much, Tom Kaoya and NCPD Choir, for that project theme song. Asanteni sana. And we are now at the tail end of our launch today. And I would like to invite the vote of thanks, which will be done by Dr. Jackie from the Ministry of Health. Lucy Kimondo. Lucy Kimondo, who's the Director of Public Education and Advocacy. Lucy Kimondo, karibu sana for the vote of thanks. And once she is done, we will remain seated so that our VIPs can leave. The rest of us, please remain seated. There is one wonderful skit that you do not want to miss. Asante sana. Lucy.
Thank you. Riding on the previous protocol, I just want to deliver the vote of thanks. First, we want to acknowledge the goodness of the Almighty God for the gift of a good day and good health. Nobody has been rushed to hospital today. We planned, God made it happen. We appreciate our chief guest, Dr. Amoth, for honoring and delivering a wonderful and reflective speech. Dr. Mohammed Sheikh, DG NCPD, we appreciate you for the role of making this event possible, working in the front line and behind the scenes. Dr. Bachili Isak, we cannot forget you read the family health, where this square lies. We also appreciate the RHNK board for the support of this initiative that will go a long way in empowering our adolescents and young women. We acknowledge and appreciate our participants from the 5 Health Initiative, the county commissioners, the county directors of health, the county reproductive health coordinators, county adolescent and youth focal points, and the national regional population coordinators. You are our leads in the county, and with you on board, this initiative will go well to achieve the expected results and impact. Our panel, we cannot forget you. You have given us food for thought. We appreciate the UNAIDS for being here, Dr. Richard Amenya, Mrs. Charity Koronya from UNFPA, and Dr. Johnston Kuya from the Netherlands Embassy. Thank you for honoring our invite. We appreciate all of you, our partners, both state and non-state actors, the National Council for People with Disability, KMTC, Kenya Health Federation, KLRC, Co-Impact, IPPF, Loala Alliance, TICA, PSS, CIF, IPAS Africa, AMREF University, CPHD, ICLW, Obuyansi Foundation, Amplify Girls, the Youth Voices, Midwife Association, Religious Leaders, and any other organization that I may not have mentioned, feel appreciated. Chief Executive Officer of organization who joined Nelly in this wonderful initiative, many, many thanks for honoring our invite. The young people, the NCPD Corporate Choir who have entertained us. Yes, they have educated us. Thank you very much. The fourth estate, with you, I know we are going to go a long way in popularizing this initiative. The management of Ladison Brew for the hospitality. Last but not least, the people who work behind the scenes, from RHNK, the CRL, and the NCPD family. Thank you for working behind the scenes to make this event happen. Thank you and feel appreciated, everyone. Let's clap for ourselves. This way, this way, this way, this way, this way, this way. Thank you.
Asante sana, Lucy Kimondo, bringing us to the tail end of our launch today. And as we come to a close of today's programs, we are reminded that meaningful change happens when vision meets action and partnerships are guided by shared purpose. Mimi naitwa Mashirima Kapombe. I've been your MC today, lakini tutakutana saa moja kwenye Nipashe Weekendi siku ya Ijumaa. Asanteni sana. We will allow our VIPs to walk out. The rest of us, please remain seated.